I developed an interest in cardiology when I was very, very young. I had a family history filled with cardiovascular disease. So I'm not surprised that when I did my cardiology training, my whole focus was really on saving people after they had cardiac events. This is an angiogram from the 1990s of a gentleman who has blockage, very clear blockage in his artery. And quite frankly, in the 1990s, I wasn't thinking about prevention of heart disease. I was thinking about what kind of stent can I put into this artery to open it up and keep it open. And as you can see, the artery is, in this case, it was really a vein, is now repaired. And in the 90s, I thought, great, I've sort of cured this guy and he can go home and get about living his life. But what is fundamentally wrong with this thinking is it took me many, many years to realize that I wasn't preventing or curing cardiovascular disease with this stent. I was solving a problem at the time, a mechanical fix for a blockage. And that's really great work, but I wasn't curing cardiovascular disease. And if you start to think about what Western medicine is really good at, the kind of things that I learned in medical school, it's all in the arena of acute care. We are the best when it comes to making a quick diagnosis, implementing a surgical procedure, medications. If someone gets hit with a truck, or if someone has a heart attack, or they have a stroke, we really know how to get mobilized and get into action and put a plan into place that's going to save a life. And that's what I spent many years of my life doing. But when you look at the research and you look at what's going on, especially as it relates to the heart, but also as it relates to the brain, these diseases that I see every day in my practice, whether it's diabetes or high blood pressure, heart disease or dementia, they are all preventable. The World Health Organization in 2006 said, hey, we have 3 in 10 deaths globally coming from cardiovascular disease, yet 80% of these are preventable through something as simple as lifestyle change. So for the last 20 years, I have devoted my life to not only looking at the science of disease and applying that into practice, what's the best drug, what's the best stent, but what is the science of health? And 108 Pearls to Awaken Your Healing Potential is about the science of health. How do I stay healthy? How do I transform my health and my well-being? And it's broken up in small segments, 108 small segments. So every day, you can add a pearl to your life. You can take a step, and each step, by the end, I promise you, will lead you to transformation. I don't want you to just read 108 Pearls. I want you to practice 108 Pearls, because we know that reading gives us information and knowledge, but practice is what truly leads to transformation. We want the healthcare industry there when we need it, but we don't want to need it. We want to be able to take control of our own health, and that's what 108 Pearls allows you to do. In the United States today, we spend more money than any developed country on healthcare, and yet we don't have the best health outcomes, and we don't live the longest. Part of the problem is this. Once we get out of the acute care setting where we're really good and we come into the chronic disease management setting, someone with diabetes, someone with high blood pressure, someone with osteoarthritis, someone with joint pain or back pain or heartburn or depression, you name it. You name any of these things that we tend to label, and our approach is name it, blame it, tame it. We have this ill to the pill mentality. So if someone says every time I eat, I get a burning in my chest, we say, oh, that's acid reflux, that's heartburn, here's a pill for that. Oh, I feel a little blue today. I don't want to go out. I don't want to exercise. I'm down. I have, no reason to live. And we label that depression. And every one of these labels we apply a drug to. So it's this name it, blame it, tame it game. And I want to break us out of that, because at the end of the day, if someone has heartburn, we shouldn't just be saying, here's the pill, or someone has diabetes, here's the pill. The pills are there when we need them. I'm not against medication. But we should also be saying, why do you have heartburn? Why do you have diabetes? Why do you have high blood pressure? Let's get to the underlying cause. If you're diabetic, you should not be eating simple sugar and white flour. You should be exercising every day. You should be eating lots of green leafy vegetables, sleeping well at night, staying away from pesticides and herbicides. How do we get to the underlying cause of the problem and put a program into place that's going to reverse that health challenge? That's what 108 Pearls is about. And it's not just limited to food and vitamins and supplements, but it's also about the way we see the world, how we interact with people, our attitude, our mental state. How do we handle stress and tension? How do we transform the way we handle stress and tension? We all need those tools in our toolbox to make a profound difference in our health. So when I see a patient at Pacific Pearl La Jolla, I always ask them to bring in all their vitamins and supplements. And this is not an unusual situation. This was a very educated gentleman who came in with all of his medications. And if you look closely, he has one supplement there. He said to me, I went from specialist to specialist to specialist, and everyone gave me something different to treat my ill. And at the end of the day, this was his regimen. So I think you can right away see what's the problem with this approach. It's living in silos. We call them ologies. Cardiology, I see the cardiologist, I get a few pills. Dermatology, I get a few creams. Endocrinology, I get something for my thyroid and something for my diabetes. Neurology, I get something for my brain. We have to break down those silos. 108 Pearls breaks down those silos, because we know what's good for the brain is good for the heart, is good for the kidney, right? There are some fundamentals to health that are basic and tried and true and evidence-based. So when we look at the gross domestic product for the United States, we see we're spending more in pharmaceutical therapies than any other country in the world. And this is our reality. And I want to change that. My goal is not only to teach physicians through the Academy of Integrative Health and Medicine how they can change the way they practice and change the recommendations they make for their patients based on evidence, but it's to empower all of us to say, you know what? I may have a diagnosis, but I'm more than that diagnosis, and I'm going to look at why I have that diagnosis, and I'm going to start to put a program into place that's going to correct that health challenge. So Mark Twain put it beautifully. He said, it ain't what you know that gets you into trouble. It's what you know for sure that just ain't so. And the reason why this quote is important to me personally is because in the 90s, when I was putting in over 700 stents a year, I never asked the silly, simple question, why do all these people have cardiovascular disease? And what can we do to prevent it? How can we reverse the process? How can we reverse diabetes naturally? How can we reverse heart disease naturally? How can we improve blood pressure naturally? And the whole goal of 108 Pearls to awaken your healing potential is to do just that. Give you the tools to awaken within your body its self-healing process. We know that chronic disease, it doesn't matter if it's diabetes, dementia, high blood pressure, heart disease, the whole spectrum, irritable bowel, and so on, arthritis, osteoporosis, all of these things, we know that they're related to our environment. They're related to the toxins we're exposed to, the way we respond to stress and tension, the foods that we put into our body, how physically active are we, how mentally active are we? Are we addicted to drugs and alcohol? What kind of traumas have we experienced in our life? Have we had emotional traumas that help us to get our relief through food? Food as a treatment for stress, alcohol as a treatment for stress, drugs as a treatment for stress. What have we experienced that has led to habits where we've learned to try to soothe our pain through unhealthy behaviors? All of these things, cigarette smoking, radiation, all interact with our genes, and it's in this interaction with our genes that we end up turning on genes that are pro-inflammatory, cause our blood to clot, make us sick. And all of this is totally reversible. Everything on this list, exposure to drugs and excess alcohol, exposure to toxins, choices about food, how we respond to stress and tension, are we getting a good night's sleep, getting rid of our cigarettes, each and every one of these things is a step toward health and well-being. Because the reality is this: we know that 70 to 90% of the chronic disease we see is related to lifestyle and environment. We know that lifestyle and environment accounts for 70 to 90% of the disease we see. And it's not only what you're eating, it's who you're eating with. If you're eating Brussels sprouts and you're angry and you're frustrated and you're seeking revenge for something that happened 55 years ago, it's not going to help your heart at all. We know from definitive studies that we can trump our genes. This study appeared in the Archives of Internal Medicine, looking at an Amish community that carries the obesity gene. Yet walking 18,000 steps a day, this community doesn't develop obesity. We are more than our genes. Dean Ornish's beautiful work on men with Gleason 6 prostate cancer. Everywhere you see red on this slide means an oncogene, a cancer gene, is turned on. On the left-hand side, you see lots of red. When these men are put into a lifestyle change program, vegan diet, exercise, yoga, meditation, group support, 500 cancer genes are downregulated. We now understand the language of health. We understand how to create health now through the language of science. We didn't have these tools years ago. We didn't have functional MRI to help us understand meditation. We didn't have functional MRI to help us understand acupuncture. We didn't have gene arrays that were used in this study to help us understand how lifestyle change impacts health outcome. But we do have that now, and it's using that language of science in the creation of health, which is what 108 Pearls is all about. So at the end of the day, our biography, who we are, how we live our life, what we have experienced becomes our biology. And we don't have to be held hostage to that. If we've had a hard life, or we've had hurt, if we've had loss, we can transform that. We can learn to love ourselves again, and in that process, we can restore our health and our well-being. I run a practice in La Jolla called Pacific Pearl La Jolla, and it's not a practice that's conventional by any sense of the word. It's a practice that focuses on health creation, not just the treatment of disease. And when we think about health creation, creating a path to health, We have to start with the fundamentals. We say food first. What you eat truly matters. We know, for example, that heart disease and dementia, arthritis, skin rashes, brain fog are all related to inflammation. We know that inflammation can be turned off by the choices in food that we make, by the supplements that we take, by eliminating toxins, by treating infections. All of this information helps to transform the underlying inflammatory process. Just simple food choices, just simple nutraceutical choices, just transforming the way we respond to stress. So food first. Fix the gut. If someone has heartburn, if they have gas, if they have bloating, if they have loose stool or constipation, your gut has a problem. We need to fix your gut so that you can get proper nutrients to the rest of your body. If you have inflammation in your gut, there's a good chance you have inflammation in your brain. There is a brain-gut-heart connection. And that connection is in the inflammatory oxidative stress arena. And we'll talk more about that. And you'll learn about that in a simple way in 108 Pearls. But food first. You are what you eat. Food does matter. Healing your gut, fundamental. Before we do anything else, we have to fix the gut. Staying active, whether it's volunteering, whether it's working in the garden, whether it's walking every day with friends, staying active physically and mentally is fundamental to health. And we believe at Pacific Pearl in the use of nutraceuticals when you need them. So if you need omega-3 fish oil to lower your triglycerides, we're going to give you omega-3 fish oil. And we're going to handpick what's the right one for you. If you need to take a B vitamin like niacin to raise your good cholesterol, we're going to recommend niacin. And if we need to treat your osteoporosis or your osteopenia, we're going to put together a bone protocol that goes way beyond calcium. We also believe in balancing your hormones. If you're under a lot of stress and your cortisol's high and your DHEA is low, you're going to be putting on weight on your midline, and you're going to come in and say to me, Dr. G, I'm gaining weight and I'm eating everything right. Because we have to balance your hormones. We use all of the global healing traditions. You know, in integrative holistic medicine, it's not just the Western medicine toolbox of drugs and surgery. We have that toolbox. But we have all the global healing traditions like Ayurvedic medicine, traditional Chinese medicine, naturopathic medicine, and so on. So we may recommend healing touch to decrease your stress and anxiety, acupuncture to help with your back spasm and your knee arthritis. Everything is personalized to the individual, but you don't recommend modalities without fixing the gut, getting the food right, getting the sleep right, and transforming the way we respond to stress and tension, enhancing our resiliency. And one of the most important things is learning to let go of things from the past that don't serve us, do our forgiveness work, and forgiving ourselves, because I've seen a lot of patients in my practice and a lot of people who hold on to things that don't serve them. And in the process of forgiving oneself, learning to love oneself. We have one physical body this time around. We have an emotional body, a mental body, and a spiritual body. And how are we going to heal all of those bodies? 108 Pearls walks you through fundamental, basic things like knowing your cholesterol numbers, to practicing affirmations, using alternate nostril breathing to relax you, learning to manifest so that you can bring those things into your life that you want and need, 108 Pearls gives you the information you need to eliminate toxins and pesticides and so on from your diet and from your home. So it's a day-to-day approach where you can take a simple step. Each of the 108 pearls I think of as a bead on a mala, a traditional chain of prayer beads. And as you take a step, you go deeper and deeper on your journey of health. We no longer say, let's just treat the symptom. We say, let's get to the underlying cause. Let's put a program into place that's going to transform someone's emotional, mental, physical, and spiritual well-being. I am so happy that you have decided to take this journey.